Take it away,
Got
Don.
it. I got it. Hi, I'm Donald Gardner. I'll be your server for the evening. I'm a member of NYPAN Green, started by my wife Carrie, and I'll facilitate for you all tonight. We're going to hold each of the segments. It's a big agenda. We're going to try to hold each of the segments to 10 or 15 minutes. So if we can respect that, that would be great. If you have a question, you can use I think you can use the raise hand logo down on the bottom. We'll try to make sure everyone's comments get addressed. So for those of you who haven't seen the agenda, the link is in the chat under agenda, of course. And the first item is to talk about what we're calling a listening forum. And I'll take the lead on this conversation, but if anyone else has some input, we certainly want to hear from you. The idea was that we think about a forum for everyone else. We've been focusing on union and medical professionals and other such specific groups. But the general folks out there, the general population out there also doesn't know about the act. And so we have NYPAN has this huge mailing list. Ting, what is it, up to 1,700?
Well, no, the total list is well over 60,000, but.
Oh, even bigger than I imagined, sorry. Yeah, so we want to reach those people as well so they can get in touch with their representatives, their assembly members and their senators. So the idea is that there's a listening forum, and the notes for this, by the way, is also in the chat under listening forum. Just about questions and discussions, sort of a teach-in with Q&A as a follow-up so that we can get the word out about the act itself and listen to people's concerns as opposed to just doing a PowerPoint presentation and putting it in front of them. Find out what they know about it, and if they don't know anything, inform them, and if they know something and it's misinformation, be able to correct that. But the point is we're trying to reach as many people as we can to listen to their stories and find out what questions they have about it. The bill pretty much speaks for itself, but who's going to read a bill? So it's up to us to pass that information along. So we have a possible agenda for that meeting, for that forum, sometime in January, that we urge attendees who RSVP to send questions in advance so that we can have time to prepare, that we begin the forum by answering the submitted questions and then open up for additional questions. And we have hopefully our panel of experts who can answer questions and bring up points not covered in the Q&A to prepare the attendees to be advocates for the Health Act in their volunteering efforts. So we're forming this now. We need somebody in the group possibly to take the lead and run with it, and with a couple of other people, because the person who takes the lead shouldn't be the person that runs with it. But if we can get a team of 2 or 3 people to take this up, that would be great. So in this moment, that's all I have to add. The comments that I put into that document, listening forum, comes from a string of emails that a number of you have sent back and forth, and I just collected the high points. So are they? Yeah, I'm looking for volunteers. So if anybody's interested, let me know. If you want to talk about it for a little bit, raise your hand and we can call on you.
Or use the reaction yellow hand.
You all okay? All right, well, you can reach me. You want me to put the link in the chat again? Okay.
I just did.
Oh, okay, thank you. Okay, so we'll move on to the next subject, and that's the working group reports. So in no particular order, can we go with labor first? Who's got labor?
Oh, wait, Steve Max has a hand up. I don't know if that's
Oh,
related to the.
I just wanted to mention that we did a rather good slide presentation at Three Parks Democrats. And as this other program gets moving, if anybody wants the PowerPoints, you can cannibalize it and take charts and stuff out of it. Just let me know.
Okay, thanks.
good. Thanks very much, Steve. Anybody else have their hand up? No, Jeff, you were going to pick up labor?
Sure. Not a whole lot to report there because admittedly that working group has been dormant since our last meeting. But I will put in the chat again a flyer that we put together that actually some other organizations have reached out to us to use as well, which is a short summary of the New York Health Act and some arguments in favor of it, specifically geared toward unions and labor folks. Quite a useful tool that we built on some existing tools to refine. I'll put a link to that in the chat. And just one other sort of piece of general news, which is that it seems like some of the unions in the coalition now are going to become more active this year than they have been in the past. There's something like a labor table forming to get more active on the pro side of this, so that we can both influence legislators around the bill and hopefully bring over some of the unions that have not been supportive up until this point to our side of the fence. That's about it for labor this time around. So maybe I'll pass it to Naomi and people to people.
Sure. So people to people, we sent around the flyers. We just got the postcards printed and just waiting on the shipping materials to send those out to people. We have, for our GANI chapter, we've got a good, more than 500. Last weekend, we collected a couple hundred more. We haven't met this month yet, so look out in your emails for planning for the next one. Hopefully we're going to have a meeting before the end of the month. In terms of thinking about the actions for the spring, so we've been collecting these postcards at events, and in collaboration with the Campaign for New York Health, those lobby day for next year happens in April, at the end of April, either 25th, 26th, or 27th. Those are the 3 days that they have planned because the session ends early next year. So right now what we're thinking about is, what's coming up next is trying to make sure that the time when we deliver those postcards are going to be as effective and kind of making as big of a splash as possible. So some of the ideas are in the weeks leading up to that postcard delivery day, working with different collaborators, coalition partners, basically, so that each group takes a day, say for the month of April, and on that day they call, either they tie up the phone lines for their either leadership or their local representative, or do something in person. So we just have to strategize around how to make that most effective statewide, if we want to have one region per week around the state, something like that. So that's what we can discuss, basically, is just kind of how to make the postcard delivery really land.
Okay, you're good?
Yep.
All right, Naomi, thanks. Ting, by the way, are you doing the minutes on this?
I have not been, because I'm busy doing other stuff. I was just thinking about that, though.
Okay, I've got some notes, but if we can share the
If
load, that
anybody
would,
can get on the bottom of the agenda, that's where the notes go.
yeah, okay,
It'd be wonderful if somebody could do it. I have to let people in and do other stuff.
okay. Next is research. Steve Shakini, I guess you and I haven't had a conversation about that for some time.
No, so we haven't actually done a lot of research recently, but we have shared some of the research we've done. Things that we have available that we can get for you easily is how much your county has to contribute to Medicaid, and how much it would save if when that's removed from your county budget. Just as an example, Suffolk County, where I am, contributes $230 million a year to Medicaid, which is about 30% of our property taxes. So passing New York Health could offer a 30% property tax cut to every Suffolk County resident. But we do have that information for whatever county you want. We can also calculate how much it would cost a county or a school district to how much they would have to pay in New York Health taxes as compared to what they pay in health insurance now. And the savings are incredible. Easily more than half their health insurance budgets.
That's great.
You have to kind of ask me for it. I'll get a I don't have it set up that it's easy to share the spreadsheet, but I can drop, but if you want me to, I can put the salaries into the spreadsheet and, help you figure it out quick.
Great.
Okay.
And Gene has a question.
Yeah, Gene.
Yeah, I'm not sure if this, I know people are working with the unions that are in opposition to this. And I'm not sure if one of the objections that might have some basis is what Steve was just talking about, that what they're spending to, what a county or locality is spending to pay for medical plans for their employees would be a savings for them. I think from the viewpoint of the unions, they've negotiated a package that costs X amount of dollars. And if you're saying to the locality, now that X amount of dollars that you're paying for your employees is going to be X minus Y, and you get to keep Y, I think the unions might be thinking, hey, that Y came about because lesser contributions to the pension plan, lesser salaries. So I think there's a sort of a problem there.
So I definitely understand that viewpoint from the unions. And as somebody who typically makes about, I live in Central Islip, and the median pay of a school teacher here is $120,000 a year.
Oh,
Okay, the median pay of a household here is $60,000. So at this point, I think it's going to be hard to convince the households that the teachers have given up that much. And I really feel like the unions need to suck it up and settle for getting better healthcare coverage, no copays, no deductibles, possibly getting their contribution, paid for by the school district again, and Medicaid, and getting long-term care. And I think letting some of the homeowners, the people who pay the taxes, catch up a little bit. I really think the unions need to just settle for getting better healthcare here. But that's my own humble opinion, whether the unions like it or not.
Do we have any sense of whether they like it and how they feel about it?
They're going to argue for their benefits,
Yeah, sure. Yeah.
but I don't think it's a winning argument anymore.
Okay. All right, anybody else for research? Okay, up next, I think, is the electoral.
Massimo raised a hand, I think.
Yeah,
Oh,
yes,
oh,
I'm
Massino,
sorry.
sorry.
Is this the first time I participate to these meetings? And what I hear is that we have the usual liberal groups here back in this proposal. But what I don't see, and what I think makes a lot of sense, is try to get the business community behind it. Businesses that offer health insurance to their workers are paying a fortune in this country. I spent part of the time in Italy, and I follow the political scene there. There is nobody left, center, or right in Italy, in any of the parties, that ever questions national health insurance, because it's just so much more efficient, and it saves, businesses don't have to deal with all the, not just the cost, but all the nonsense that goes together with running a health insurance for your workers. At one point I had a small business. It was just ridiculous. We tried to get health insurance. We were a small contractor. They just laughed at us. And we still had to have workers' comp, just to describe the kind of bullshit that one has to deal with. One day, one of our workers got hurt. So we had
Massimo, can you
workers.
try and wrap it up? We're getting,
Yeah, just
thank you.
just a second here longer. he also had VA. We had to spend 40 hours trying to figure out which was the VA or the workman's comp had to pay for the guy's injury. That kind of bullshit is running all wild throughout the whole country. And
All right.
the business community has to jump into this.
Messino, you make a good point, and I think some of the folks have been involved with local chambers of commerce, and we're trying to see if we can crack into that space. That's a difficult place for us to go, but it's well intentioned. It's a good thought. We have to keep going. We'll move to the next electoral.
Bob Greenberg had his hand up. I don't know.
Oh, Bob, I didn't see it. Sorry.
Thanks, Ting. I just wanted to just add something on the union thing. The teachers, they have it so great, right? First of all, the median for teachers is not 120,000.
It is in centralized.
It takes about 20 years to get to 120,000. And also co-pays. We will have co-pays starting the new year. And the other thing is that the New York Health Act will cover optical, hearing, and dental. The welfare funds of the unions carry that, and they're terrible plans. Those three parts are terrible. So and also now we're going into this Advantage Plus plan, which is Medicare Advantage, which is a privatized plan, and we're going to be having to pay $200 a member a month for that plan to stay in what we have now. So it isn't a pretty picture when you get a little closer to it. And I don't want to get into it because we don't have time, but there are many ideas of why the leading public service unions, the teachers and DC 37, are pushing this plan.
Okay.
I would like to reply to that real quick, Bob. Using Suffolk County as an example, not a school district, because I don't have one in front of me, but using Suffolk County as an example, Suffolk County has just a shade under 11,000 employees. Their health insurance bill for those employees is $959 million. Okay. Under the New York Health Act, if they paid 100% of the tax, not just the 80% required, but 100%, under the proposal that Rodberg has given us for raising the funds, Suffolk County would only pay 126 million annually. Like that's almost an 85% savings. Okay. Every school district would see similar. All right. But
Okay.
At the end of the day, it's seeing similar. It's getting better healthcare coverage like you described, and doing it and not having to make the teachers contribute. And that savings still exists.
All right,
I
good response.
can talk to you about numbers about that if you want and show you where they come from.
Yeah, good follow-up. All right, thanks all for that. We need to keep going.
I'm sorry.
Are there any other hands up that I didn't see, Ting?
Nope.
Okay, next is electoral. Who's here to?
That's me.
Oh, okay.
Okay, so electoral, I put a link in the chat to a form that we've been working on, which I hope to put to bed on Wednesday at our next meeting. If anybody wants to come, you're welcome to come. But the idea is to circulate a form that has had many names, but last year it was called a pledge form, and some people didn't like that idea, but that's the idea, even though we're not calling it that, to try and find out exactly where each senator is on the bill and move them up the chain as best we can to try and then get them, after we find out where they are, to go to the next step, whatever that next step might be. So I don't want to take a lot of time tonight, but if you can take a look at that and get back to me with any thoughts you have about it, when you get a chance, that would be great.
Okay. Any questions for Ting? I don't see any hands.
Ooh, great. Moving right ahead.
Okay, all right. The final one is medical professionals, and Susan, do you want to just summarize really quickly what we talked about this week?
Well, we talked about getting in touch with medical professionals as well as the people in their offices. It would be, I think, very good, or we discussed about having the billing persons, the physician's assistants, the nurse practitioners in medical practices sign on. So we are looking to put together a bifold folder, because you can't really speak to medical professionals while they're in their workday. So it would be a matter of leaving these folders at practices for them to review, including endorsement letters, and pick them up, say, a week later to see what kind of feedback we got, so that we can curtail in the future as to how to bring more medical professionals on. One thing I just found out here up in Ithaca College is establishing, I believe in the spring, a physician's assistant school. And so with that, we perhaps could table outside of that coursework, as it were, and see about getting new students involved and signed on.
Great. And I should also add that we're pushing real hard to get these letters now. The letter from the volunteer to their doctor, and from the doctor to his or her colleague. We leave those two letters, and Susan now is developing a non-physician's letter. So the folder will be quite robust, with 3 letters, a bifold, and the handout that we've been using that has a QR code on it, so people can actually sign up. Carrie's got her hand up, and we can't hear you. Go ahead. I'll turn my system off. I'm off.
He's not on.
It's off.
Must be muted.
All right.
So.
We're in the same office.
Carrie, you're muted.
Okay. So just on that about the doctors, I just hope that everybody makes sure, all of us as volunteers, that we all go to doctors and we all can carry these letters with us when we go to doctors. And there isn't a doctor that I go to that I don't ask when I'm in the examining room, do you know about the New York Health Act? And we just had an amazingly wonderful response from a doctor that I went to last week. And he mentioned that a lot of his colleagues, he likes it, but a lot of his colleagues they just view this as a big business for themselves. And so we followed up with information from PNHP about the fact that doctors actually make out better with the New York Health Act. So that, I hope everybody is really seriously taking that letter with them and talking to their doctors whenever they have a doctor's appointment. It's easy. Thanks.
Okay. Now I got it. Okay, thanks, Carrie. Yeah, we're the volunteers. So to emphasize Carrie's point, that we should all, and I will put into the chat the links for the 2 letters, the volunteer to provide a letter and the provider to provide a letter. I'll put those 2 letters in the chat in a little while. Let's move. We're on time, so we're doing okay. The next piece of the agenda is upcoming actions, holiday cards to legislators. And Mary Thorpe, do you have that one?
Well, I just wanted to float an idea. I've gotten emails from a couple of different organizations. Common Cause had their first postcard party last night, writing to Biden about the voting bills. And Nurses United are having similar meetings Tuesday and Thursday, writing letters to congressmen about their working conditions. And I just thought it was a great idea. Common Cause really built it up. Wear your holiday garb and have some eggnog or whatever in hand. You write postcards. And I just thought it might be something we could do for the New York Health Act. A fun idea. Not that I'm volunteering, but I just wanted to float the idea.
Okay, we got that. Thanks, Mary. Next on the agenda.
Hey, Don.
is-
Don,
Yeah,
quick question to Mary.
go ahead.
So do you have a template that we could circulate that people could print their own? Or what kind of cards are these?
postcards?
Just regular postcards?
Right, you're talking about postcards?
Yeah.
Well, we'd use the NYPAN postcard. Anybody can print those, right?
I'm only aware of the ones that for the Health Act that are two-sided.
Yeah.
You can't really mail them.
Yeah. Oh, I see. Well, you can print them on one side and then use the other side to address. Yeah.
Yes.
It's just an idea. I think it would be fun. I don't know how many people in my group, I keep asking them to write to their congressman and fill out the postcards, but I don't know how many actually do, but they might come to people like to write postcards in my group, so they might come to a holiday postcard party.
Yeah, okay.
Mary, would it be useful to have the provider letters that we've been using? The letter from a volunteer to a provider and so forth?
We could do that. That would work. Yeah.
You have access to the links for those two letters. I'll make sure that they're in the chat.
Okay.
That's what I'm doing
I'll tell you what, I
offline.
will send around to the group what Common Cause is doing and what Nurses United is doing, so to get the feel of it.
Okay. All right, good. Thank you. Anybody else for Mary?
Oh, Naomi has her hand up.
Thanks. So Mary, whenever they fill out these postcards, I think it's a great idea to do it as a holiday party kind of thing. When they fill out these postcards, are you gonna keep them?
No, they would mail them. That's in the letter. We're asking you to, pay postage this time. Asking the volunteers.
Well, we've been doing it to where, whenever we go out and we have tables and everything, and people fill out these postcards, we keep them. And we're planning to deliver them all together at once to show kind of like this huge impact and a big stack.
Yeah.
Would it be possible for you to keep a hold of them until April?
That's a little tricky. We're not getting together. Everybody's isolated over here. So that is a bit tricky.
Or if you could even mail them.
But the NYPAN postcard, it's just sent directly with the QR thing. This goes directly to the legislators. So we don't have those to give, to give to them on a big pile. That's done automatically.
I'm sorry, I missed that. What were you saying?
NYPAN's version of the postcard has the QR code on it.
Well, that's a flyer, not a card.
Flyer.
Different
Well, yeah,
purpose.
you can make it into a postcard. I'm sorry. Right. So you don't have those to hand in, unfortunately. Those go directly to the legislator.
Yeah, well, the way that we were thinking about it, they kind of serve these two different purposes. The flyer is like for people, we hand them out, we give them to people to stay in touch, and you scan the QR code and fill out your information, and they get added to our email listserv, and they find out about upcoming actions, and people follow up with them. And then the postcard is kind of like a petition, but just a petition that would be a more visually impactful in the form of these postcards. So they kind of like are intended to serve these two separate purposes.
Recording in progress.
Okay, somebody's got some link. Yeah, I will. Carrie's got her hand up, so I'm gonna take my sound off and mute myself.
Okay, yeah, we have a little process to be able to, anyway. Naomi, when we were tabling a couple of weeks ago, I found people did not want to provide their private information on the postcards. And I'm concerned how much of an issue that I think the bigger thing is that they just sign it and we collect them to have a bulk. I mean, I probably could have gotten a lot more signed if we weren't asking for private information. Just thought I'd mention that. I don't know what your
I
thought is on
haven't
that.
found that problem personally when I've been tabling. We just kind of let them know that we just need their address to show.
Hey, now I hear you. Sorry, I had the volume.
Oh,
off.
okay. So yeah, just to show that like they live in the state of New York, basically. I mean, that's the purpose of having their information filled out. They don't have to put their phone number and email actually. But we do need like their physical address just to show their resident.
And to know which senator they belong to.
Yeah.
Yeah, so people just.
And then
think
the email, we just let them know that the email and phone number is there to make it easier if they want to, you know, stay in touch or find out about like rallies or actions or anything like that.
Yeah. Yeah. Yeah, okay. All right, good, thanks. Anything else for Mary? Okay, thank you. We've got the next item on the agenda is this month's tactic, local resolutions. Jeff?
Yeah, thanks, Donald. Yeah, so we've been trying to introduce a tactic at each meeting, and this week we wanted to talk about local resolutions. So these are resolutions by governmental bodies on all levels of government in support of the New York Health Act, and you know, potentially non-governmental bodies like Democratic committees, for example. And you know, these have been a great tool in the past on in a few different ways. You know, one, of course, it's great to get the voice of local governments to the legislators, especially in those districts that they support this bill and they want to get it passed. It's also a good organizing tactic. It's a great way to get people talking, thinking, and learning more about the New York Health Act. And you know, it also, I think, breaks down on a local level, especially the financial argument that can be made for the New York Health Act, because a large portion of these resolutions, in many cases, is focused on the savings. As Stephen mentioned earlier, they're substantial, and so a couple things. Just I want to show you, you know, a couple of samples from things that we've gotten passed in the past. I think we're up to 22 or so governmental bodies across the state of New York, from the level of villages and towns to counties and to New York City as well. And then a couple of Democratic parties and even a community board, I believe, that's signed on. But in each of those cases, I think there's a pretty consistent strategy that's proved successful. And I would say that maybe the most important element of it that I've discovered, and actually was handed to me as advice from, I don't think Gina is on tonight, but when we started our effort in New York City to get them to pass a resolution, she gave me a great piece of advice, which is to start by finding a champion. Find someone in that legislative body who supports your cause and is going to fight for you within it. It goes a long way. You know, there's other stuff you can do, certainly, but I think that's the most effective thing. You know, especially if they have some clout within, you know, whatever it is, a state, county legislature, or your town board, or whatever it is. So that's number one. I'd say number two is to, you know, build some public support around the bill. What we've done in some cases is start a petition for people in the community to sign on to, which states, you know, roughly what the resolution will say, and you know, getting as many people to sign on to that as possible. That's also proved effective in getting these things passed. And then, you know, putting the screws on these folks is another. You know, you really need to bring the pressure in some cases to get them to do it. That certainly was the case in New York City. It took about a year for us to get that passed. In other places, we're working on 3 of these right now in the Hudson Valley. So I live in Cold Spring. I think we have a new administration. I think we're going to get one passed here within the next couple of months. The larger town that I'm a part of passed one in 2019, which I'm actually going to show you in a minute. And we're working on one in Ulster County as well. Oh no, actually 4. In Beacon, and I think that's going to happen probably within the next few months as well, and then in Ulster County. And I think you know, all of those are effective, all of those levels. So let's see if I can share my screen here. I will do. So I'll do it all desktop. Let's see, can you see this resolution? Yeah, so
Yes.
this is one we passed in Phillipstown. We did all of the above. We found somebody who was sympathetic to it. We did a petition to get them to pass it. And we offered them, and this is another thing I didn't mention, we offered them a draft, make their job easy. And I'll put these sample resolutions in the chat. It's much easier for them to do this if they have a sample to look at. They tweaked it a bit, but it has a lot of provisions, especially about budget items. And for the level of a town, things that are relevant to that are not just what the town will save, but also the school system within that town and the county that it's a part of. All of those are relevant to the resolution they're passing, and so it's good to collect that information. And Steve is great about doing this when needed. And I think these numbers came from a different source, but here's a sample of the budget crunching that we did on the Haldane district, which is within Phillipstown. You can see there it's a couple $1 million that they would save every year. For the county that we're a part of, it's a lot more.
Jesus.
21 million. Yeah, exactly. And that's honestly on the county level, that's small. A lot of them would save more than this because not only are they getting huge savings on their healthcare expenditures, as Steve pointed out, there's also a large portion of the property tax bill that goes to pay for the Medicaid portion of that the counties are responsible for. They would save on that as well, and or pass it on to their employees in the form of larger salaries, and or saving taxpayers money by cutting their property tax bills. So when governments look at numbers like that, you can see it even in, I would say, conservative places. Now, Putnam County is very conservative, and they have not even considered looking at the New York Health Act resolution yet. But I would say even in slightly more conservative districts, these kinds of numbers speak loudly.
Yeah.
It's 21 million.
21 million per year.
Annually.
Per year.
Wow.
And
Wow.
this is based on this was based on their expenditures in 2018. So for all we know, it would be a little bit more than that.
Higher, bigger.
Yeah, it's just
And
a
you actually put this in front, you could put this in front of a school board in a presentation?
Yeah, you can put it in front, exactly, or send it to the legislator as a package, and then they can present it when they're talking to their colleagues. These are, there's, like I said, these are strong arguments. And yes, if I was ever, well, I did do a presentation to the Phillipstown Town Board on this. I don't think they asked for the numbers at that point, but it was part of the package of materials that I sent to them. And just one more we did, here was just for the town of Phillipstown. They'd save about $800,000. So, putting those together in advance, maybe even before you approach that first legislator, is a good idea. And then, following it through, like I said, it can take some time, it can take some lobbying and, some public pressure to make it happen. But, I've seen it happen all over the state. And every time it does, it adds another, really important voice to this conversation on the state level. And I would say especially the state legislators in those districts where those municipalities reside, pay attention to them. So worth doing. And if anybody wants, more detailed advice and or assistance in doing a resolution like this, please reach out to me. I'll put some of these resources in the chat, but yeah, feel free to reach out. And and just the last thing is, I wouldn't, as I mentioned earlier, limit yourself to governmental bodies, because we have had some clubs like the Democratic Club. Let's see if I can get this up. This was one passed recently by the Three Parks Democrats in Manhattan in support of it. So that helps get the word out within these clubs as well. Yeah, Leslie, I see your hand up.
Thank you. I wanted to just say that back in 2017, we did one of those here in Tompkins County. And then because we did that in Tompkins County, we were able to then reach out to neighboring Chemung County, which is a very conservative county, and bring it forward there as well. I know that Mary Thorpe and Susan Beckley were involved with that back in 2017, but it doesn't have to be, it can be a very, very red county. Chemung County, their county executive is Chris Moss, who was Rob Astorino's running mate. And obviously has designs on higher office going forward, and is a very conservative person. And it got traction in Chemung County. So you're absolutely right, Jeff. This can happen anywhere.
It really can. I mean, it's hard to make an argument from the conservative standpoint that you don't want to save money, save taxpayers money, and have a more efficient system, which is
Exactly. And there was
is.
a moderate county legislator who took this up back in 2017 and really got traction with it. So you're absolutely right.
Yeah. Great. Any other questions?
I just have a comment. It's a beautiful, it's an amazing setup, Jeff, what you guys have done. And it just strikes me that this is something we all can do. If all of us who volunteer, we can step up and just find out where our school district is at. Go to Jeff, find out what the templates are, how we get the information, and make the appointments. It's not easy, but wow, what an access! What an access! Thank you, Jeff. It's great.
Absolutely.
Give me my screen back. Okay.
Do you know how I do that?
Oh, Tang's got his hand up. Sorry.
You got it. Okay.
Hang on. Yeah, it's at the top of your screen, but I'll just stop it. There you go. Yeah, when Dr. Jolly was doing that, he added a kind of a twist to it, which was to find overlapping districts: school, fire, water, township, town, etc. Because then you really multiply the effect of your work.
Bob Greenberg, I can hear your hand is up.
Thanks.
Yeah.
Jeff, could you start me off with the Hyde Park District in the Mid-Hudson Valley?
Sure.
Okay,
Absolutely.
my daughter is the superintendent, and I wonder if we can work something out there.
Absolutely.
Thanks.
Sure.
Anybody else? Any other hands up? It looks like none. Jeff, thank you again. So up next on the agenda, questions for Helen Krim's January 23rd forum. Yeah, not to be confused with tomorrow night's Buffalo DSA teach-in. They're obviously two separate initiatives, but or the listening forum that we're trying to set up for next month as well. So this is different. What do we have on that? What information do we have?
Helen is here, actually.
Oh, are you?
Yes.
Oh, great, Helen. Thank you. Go.
We're having a town hall on the 23rd of January. And all of our electeds are going to be there. Dinowitz, Biaggi, Senator Rivera, and Dick Gottfried will be there. What I've been assembling is a very diverse group of community organizations to ask questions. And I want there will be a 5-10 minutes from Dick Gottfried on the bill, what it does and why we can afford it. But the other electeds will only speak for 2 minutes as to why they are co-sponsors. The point of it will be to have the community groups ask pithy questions, questions that are real for them, and which raise the priority and the urgency of getting the bill passed so that Biaggi and Dinowitz make it their first priority. And so I've gotten some questions from Indivisible. I have a question from somebody who has been very interested in medical education and whether or not the bill funds it adequately. Somebody else raised medical malpractice, and does the bill address that? But I am coming to this group primarily, and I've already spoken to Jeff today about this, we want some union groups to participate. I've got the Domestic Employee Workers Union, and NISNA, but these are very closely associated with healthcare immediately. PNHP is participating. But I'd like something like 32BJ or some other group that is for whom this is a stake. And I'm hoping, for example, that my representative from the Chinese Planning Council will be able to ask a question that will make my officials realize that this is a statewide urgent priority. So I was hoping that NYPAN could come up with some good questions.
You want to stick your email in the chat, Helen, for people that have questions?
Absolutely.
How do you want to do that?
I will do that.
Okay. Any other questions for Helen?
Who's sponsoring?
Carrie wants to know who is sponsoring this, Helen?
Northwest Bronx Indivisible.
Northwest Bronx.
Well, we gotta get NYPAN.
Can NYPAN be a co-sponsor with you?
NYPAN is a co-sponsor.
Oh, okay.
I already have your logo to put on the flyer.
Yay. Okay. Okie doke. Anybody else for Helen? That sounds great.
Yeah, Helen, you're just looking for some union members to ask questions?
Yes,
Perfect. I'll see what I can do for you.
wonderful. Thank you.
And they don't, Helen, they don't have to be in district, right? They can be somewhere else.
Yes, they don't have to be in the 81st Assembly District.
Right.
Or the 34th Senatorial.
Okay. Real good. Thank you, Helen. All right, next up on the agenda, new ideas for outreach. Ting, your brain dump.
Okay. This comes out of talking with a number of people over the last couple of months about how well we've performed over the past few years. And we've done fairly well in many regards, and we move forward slowly, but we haven't actually won. And so part of it is this particular piece I'm talking about tonight are two ways to try and use shock and awe, if you will, that Republicans do very well with their stuff, and we don't do very well with our stuff. In particular, a series of healthcare horror stories that we would put out there on a daily basis. And the other is a kind of a longer video of some sort related to the moment at which we cross 1 million COVID deaths. That seems like a moment that we could get considerable traction and visibility.
And it isn't that far away.
No, probably not. I mean, last I looked, it was thought to be in late April, but it keeps creeping daily closer to us.
We're over 800,000 now, yeah.
Yeah, so, I mean, it's, for a while there, it was going further away, but now it's coming closer. So what I'd like out of tonight would be to try and find out if there's anybody interested in either of these ideas, so we can start talking about them. And I put down what the needs are for some of them. It turns out, by the way, I put on the first one, use existing CNYH videos, but in talking to the campaign, they seem to feel that's not a good idea. Not because of healthcare horror stories, because that's what they were designed to be, but that they don't seem inclined to make use of them for some reason. So may have to take that off. But so we may have to record our own. That's the bottom line.
I know.
But the idea is that we've got one of the impetus for this was the whole idea of the anti-smoking ads, which may turn your stomach and whatnot, but they really grab you. And I think in a way that much of our stuff doesn't grab people. It's all very, well-intentioned and, well argued and so forth, but it doesn't grab them at a visceral level the way, again, the Republicans do with some of their issues. So I think it bears first of all thinking about, and if people want to work on anything like this, please let me know. I'll put my email in the chat.
Ting, I have a question about it.
Sure.
The collection and production of these videos or horror stories, that part seems somewhat straightforward to me. How do you plan to publish them, get them out there?
Okay, by the same techniques we've used in the past for Twitter storms and so forth. What I would envisage would be a team of people that every day take one out of a library and post it. And they post it to, let's say, their Facebook page and their Twitter page and their Instagram page. They have one or whatever they got. NYPAN would do similar through a number of channels we've got. We would hope to build also some force with, I don't know if folks are aware, but NYPAN is now the official New York State representative of our revolution, which gives us considerably more clout than we had before. In particular with technology stuff, they have a lot of stuff we can use. So I think there'd be channels, but it will take some people. I mean, actually, I see that as the easier part of it. Collecting the videos is not the easiest thing, because you got to find the people and get them to agree to it and stuff.
Okay. Anything else for Ting?
Oh, and the one last thing about it was I have in mind that we might want to, or not under NYPAN's umbrella, apply for a grant to produce the Million Deaths video. And I'd be willing to take on that. And if anybody wants to work on that with me, that would be great. And we'd have to do it pretty quickly, obviously, but.
I'm intrigued. I will say that.
Sorry.
Helen said that.
Yeah.
Helen said that she was intrigued. Helen
The minutes will note that Helen said.
Bandwidth, but
Everybody got that? Everybody got that, Helen?
Helen's intrigued. I got it in the minutes.
Okay. Very important.
All right, cool.
Thanks, Helen.
Right. Carrie, you had, Emily has her hand up. Carrie had her hand up. Emily, go ahead. She took her hand up.
I'm multitasking, but I'm jumping in right now because I have an idea. I like what Ting has just proposed. And I think a cool person to interview for multiple reasons would be this guy that I know now from the state committee. His name is Nobles
Crawford.
Crawford, yeah. Because not only is he articulate and a young person of color and sort of connected with things, he's also now missing work and everything else for the second time he's had COVID, even though he got full vaccination and booster. And I guess thank goodness he's got an employer who's flexible and able to handle this and so forth. But just imagine what that would be like for most people. He's got young kids. He's got to isolate, and try to deal with all this stuff. And he's also his background is in marketing, so he would probably be able to also give ideas about what to put into a hard-hitting ad and to make it really.
Well, actually, he'd be two things, right? He'd be one of the case histories for the first one, but he might work on the second one.
Yeah, he might be able to advise and also be a subject matter person.
I just put my email in the chat. So I would ask if people have any ideas of people who have terrible stories and cases, just send them to me so I can keep track of where they are. And later on, we'll try and go after them when we get it going.
I'd like to suggest that you also consider things that would not be ordinarily considered horror stories. Anybody who's tried to find out what drug plan they should sign up for.
Mm-hmm.
That is such a universal nightmare in the current system. And it could be hilariously funny if you get the right person doing it, but it will be also very universal and hard hitting.
You're right.
So lots of opportunity there.
Yep.
Okay,
Yeah.
so Ting's the van for follow-up. Yeah, Massimo.
Sorry to disagree. I don't think that people need to hear horror stories on TV. They hear them from their neighbors all the time. I mean, everybody has a story about arguing with an insurance company to get a medicine covered, to getting high bills. I think what we really need to is present a good, viable bill that really makes things simple and improves life for everyone. And
It's called the New York Health
I
Act.
have some questions about this bill because I think one of the problems is it still keeps the employee in the system. We should get the employees out of health insurance, and it should be a simple percentage of income tax that covers all your health problems and just simplifies all the bureaucracy that we have to deal with.
That's the intention of the
Essentially
Health
what the
Act.
act is about.
Yeah,
Matsuo, would you like to follow up with one of us, with Steve or Jeff or anybody to find out more about
Yes,
it?
I would. Yes, I would.
okay, feel free to contact any of us,
Yes.
because we can point you to the act. We can point out the high points. So it's good. Thank you for raising those concerns. Well, it's a good test of what we can show you what the act provides. I saw two other hands, but they went by quickly. Mary, I think you raised your hand, and Neva.
Oh, I just wanted to disagree with Massimo. I don't, of course, the problem is how do you get the message out to the people that need to hear it? But, you know, in tabling, I've talked to so many people, I don't talk to them, they just walk right by because they say, no, I'm good. We have no
Right.
problems with healthcare.
Right, I'm good.
Yeah, I'm good. You know, no matter if other people have problems, but no, the message still needs to get out there.
It does.
The thing is,
It
we've
does.
been putting this message out, Massimo, for almost 30 years now.
You know, I was at the Y today, and there were two gentlemen, you know, they looked like fairly okay people. They weren't poor people by any means, but they both were telling horror stories about huge bills they were getting from hospitals, insurance companies that didn't pay. You know, I hear these things all the time.
Great.
I
We'll
mean,
send
I
those
have
people
problems
to
with
the
like
direction.
getting medicines for my kids, and you know, had to keep arguing with insurance companies, with pharmacies. I mean, this is happening everywhere all the time.
Exactly.
Carry a stack of flyers. Oops.
We
Carry a stack of flyers with you. Whip it
Yeah.
out, shove it in their hand.
We always carry them. Carrie always carries them. That's why she's called Carrie. That's Earl's had his hand up for a while here. Go ahead.
Something that I heard the other day, or I've heard it a few times, is you know, people on Medicaid, and they're afraid to lose their Medicaid, so they're afraid to tell the truth on their taxes, or afraid to get a job that actually puts them on the books. And there's a bunch of people in that boat, and if we pass the New York Health Act, that changes a bunch of stuff for those folks.
Yeah, everyone's insured, and so doctors will cover everyone without question. That's a hard concept.
Not only that, but you don't have to be afraid of getting a job. People are afraid to get a job that pays them because it won't be enough to cover healthcare and everything else. So they'd rather work in a different kind of economy, you know, cash, you know, and so it affects all of our economy that way, with people that are like, just in order to get Medicaid, I can't work.
Right.
Because I need Medicaid. I got to be eligible for Medicaid. I can't make more than a certain amount of money.
Right. And all the head nods you see are the choir responding to your preaching. So this is the word that we have to get out. And I know from Carrie and me, our experience is that if we can find a hook, just get them to stand still for a minute without people who are saying, no, I'm good, I got it. I got a great health plan. I don't need a health plan. Like, if we can find a hook to get them interested, at least to stop walking. Then we can reach to them and hand them that piece of paper with the QR code. And as Carrie says, join the millions of people on marching. What do you say? How do you say it?
Mass movement.
Mass movement. Join the mass movement.
Helen, there's somebody else
Absolutely.
joining with your name.
Who?
Not that I know of.
Well, I just let somebody in who, the thing said Helen Meltzer Krim.
Hi, it's Daniel Renalps.
Oh,
I'll change my name.
Oh, thanks.
Thank you very much. Okay.
And Gail has her hand up.
Gail Myers. Yeah, go ahead. You're muted.
Sorry, I was late. Thanks for letting me in. I wonder if there's a way of doing one of these ads with a library board of trustee member shaking their head about how they're going to balance their budget and get the books that the kids need and have the library as a community center when they're paying so much for the health premiums. But the New York Health Act will save our school district this much. I find that when I have spoken with people who say, not me, I've got great health insurance, goodbye, and they don't want to hear, but tomorrow you may not, or other people may deserve you fighting for them, they get hooked on the property tax piece.
Mm-hmm.
Yeah, so that's what we're looking for is hooks, right?
Excellent point.
Know your audience. When we were standing outside of Honest Weight, which is a co-op up in Albany, we pretty much knew the audience. We had a sense they were, going to be interested, and we did get a tremendous response. But we also got a bunch of folks who just said, I'm good, and walked away.
Yep.
So the key is don't take it personally.
I just wonder if there could be a side-by-side, same kind of scenario, person sitting at a table. One is the library board of trustees member trying to balance the budget. Another is you or me, Jane and Joe Smith trying to balance our household budgets, and then telling the story of how healthcare is putting them into debt. But if it looked the same and it was like the same words and the same story coming out, it might be really intriguing to run those side by side. The story keeps continuing. With the same.
Cartoon.
That's a good idea. You got it, Ting? Ting, you got that?
I got it. I don't know what I would do with it, but yeah.
Well, let's talk because Gail, you make a good point. So thank you for that.
Yeah, I mean, I'm going to need people to help create all these things.
So you had a final point, I think, Ting. Should NYPAN apply for a grant, perhaps?
No, I already asked for that. Right?
Oh, you did. I'm sorry. Earl, go ahead.
While we're talking about hooks, I think the one that has been effective in the street was, why should your health decisions be? Why should you have to run it by an insurance agent? Why don't you and your doctor get to decide whether or not you need an echocardiogram, for instance? Even simple diagnostic procedures, people have to go ask and see if it's covered with an insurance agent. And so most people really understand that as an issue of freedom and choice to be able to make the decision for their health with the doctor and not with an insurance agent.
You bet. What we call that is take the healthcare insurance companies out of the equation. Don't let them stand between you and your doctor.
Yep.
All right. Anything more for Ting? You gave us something good to finish up on. Yeah, Carrie has something she wants to say real quickly, and then we want to just talk about Dick Gottfried for a little bit. Carrie, go ahead. I'll turn my sound off. Yep.
You have to mute.
He did.
Okay. So I think we're really in a great place, this whole organizational effort that we have, but I just wanted to run this by you. I was listening to Donald when he was running the meeting the other night with the medical professionals, and I had this thought. It was this lesson that we learned, which is very basic and simple, and to some extent, we're already where we need to be. But I thought I would share this just so that we can be certain we're hitting every necessary step to get this legislation passed. So the goal is the New York Health Act is voted into the state law in 2022. Boom, that's pinned up on everybody's wall. So working backwards from that, what has to happen for this to be achieved? So I'm just going to quickly read these, and then we can each try to make sure that we're going to hit all of these. And this is not the only, this may not be everything. I'm sure Jeff will have a lot to add, and Ting and Stephen, but let me try this. The most closest to getting it passed, a majority of assembly members and senators have to vote in favor of the New York Health Act. Before that, it has to be brought to a vote in both houses. Before that, the bills have to be approved by both committees. Before that, we need commitments from a majority of these legislators to vote in favor of the New York Health Act. Before that, you have to be calls, lobbying meetings, petitions, and we need to flood the legislators' offices with all this. Before that, we need a mass movement of constituents and medical professionals to make calls, meet with their legislators, write letters, and sign petitions. And before that, we need massive numbers of constituents and medical professionals to be educated and activated. So here we are. We volunteers need to outreach in every way possible. I think the big one, and I don't know how we do this, is press coverage. Hold forums, table, talk to people and medical professionals everywhere, anywhere, every day. I give you that.
Donald, you're muted.
And to that, we say amen, amen. Final point to talk about, Dick Gottfried stepping down next year. Is there anything, Ting, that you want to add to that?
No, but I want to note that in about 15 minutes, we have a hard stop.
We're cruising to the finish line here. I think we're doing great.
Yep, we are.
Are there anything anybody wants to say to be complete with this meeting?
Yes, this is Gail again.
Yeah.
I live in the Capital District, and I got an assembly survey from Assembly Member Pat Fahey. And it asked a number of questions and asked for constituent input. One of them was on the New York Health Act. And I thought that the question was leaning towards encouraging me to say no, because it ended with how much it was going to cost. And so I commented back to the Assembly member. I've been working on this for a long time. What I'm wondering is twofold. Have any other legislators sent out constituent surveys with New York Health Act? I'm wondering whether this is kind of a standard push so that legislators who are on the bill are able to say, well, my constituents don't want this. That's why we're not going to vote on this year. And then the second thing is, if legislators are sending out constituent surveys, even if New York Health Act is not on it, how can we make sure that everybody who gets one of those is saying, and we need the New York Health Act? So that's my moment. I've already shared it with Gottfried's office.
Okay, great. Thank you for that, Gail. And finally, just a reminder that the Buffalo DSA, Democratic Socialists of America, I think, as a group is doing this teach-in tomorrow night on funding the New York Health Act, which I think we get all benefits from. So I encourage you to pick that up. I think there is a link that I put into the chat that has that link. So I encourage you all to sign up for that tomorrow night, Tuesday, 7 o'clock. And the paraphrase, is there anything else left to do tonight?
Yeah, two hands up. Jeff and
hands
Naomi
up.
have their hands up.
Okay, Naomi and Jeff. Naomi, go ahead.
Okay, I just wanted to say on the Dick Gottfried thing, somebody, I guess, like, if it's his last year, then he should be able to burn everything down behind him. And I think that he needs encouragement to do that, because he really hasn't been that, like, radical, but I think that he does genuinely want the New York Health Act to pass. So I don't know, like, that's just something that I think we should strategize about, like getting him to give us as much information as possible. And to like really use him as an inside source more than ever.
And I'm sorry, I missed the subject. Who is this about?
Dick Gottfried.
Oh, with Dick Gottfried. Okay, got it. Okay, and who else had the hand up? Bob?
Jeff.
I did,
Jeff, I'm
Donald.
sorry. I'm sorry.
Yeah, I mean, I had a somewhat similar point to Naomi's, that this is a real in a way, an opportunity. Dick retiring. Yeah, I hadn't thought of that component. Maybe we can radicalize him a little bit. He's pretty radical in his politics, but not always in his methodology. I mean, I think there's, another way we can do that. And Steve brought this up earlier, is to really, amplify this event. He's the longest standing, I think, ever legislator in the New York State Legislature, retiring after 30 years. I mean, 30 years is a nice round number. I mean, these things are, of course, trivial in comparison to the lives we're going to save by passing this bill, but they give us a good sort of talking point and occasion to use his retirement as an excuse to make a push in the next year to pass this before he retires, because he's been carrying it a long time, and he's the best person to see it through, at least to full passage. And I'll just put a tweet in the chat that I just sent out on Steve's recommendation. I think it's good to also capitalize on what Governor Hochul has just said about Dick retiring, and put some pressure on her in that respect.
Okay, great. Thank you for that. And if there's nothing else, to paraphrase Brian Williams, have a productive week unless you've got other plans. We'll
Just
see
a
you.
sec, Steve has his hand up.
Oh, I see it. Yeah, Steve, go ahead.
Very quickly, one of the main things to discuss with Gottfried is who is going to be the next chair of the Health Committee and how that process works out. It's not strictly seniority, and we need to get some idea who the candidates are and start working on them very quickly.
Good point. Well done. Okay, that's it. We'll see you on January 10th for our next meeting. Have a good, productive week. Good night, everybody.
Good night, all.